Welcome, Wakefield, to unfortunately another edition of our COVID-19 update. I think we're all following the news, and we've seen locally, in the state and nationally, some increases, which I guess was not unexpected given the people going back indoors and what have you, people back in the kids back in the schools. But there are things that we can do, and we are doing, and locally. We'll talk about that shortly. But before we go into Anthony to give us an update, Julie Smith-Galvin, who has a day job, people, but she does take time to do all of her civic duties, would like to say a few words before she goes and does something that actually pays her.
Steve, and I will be brief because people are here to listen to you who have their real strategies. But just, we're going to Thanksgiving. We've seen the news. I just want everybody in Wakefield to stay vigilant, enjoy family, but just be careful, masked when necessary, and celebrate outside. We've had some good weather, luckily, some great opportunities to be outside. I am looking forward to being volunteering at the COVID clinic this weekend, and hope we see lots of kids there. And great news yesterday out of the state that people can get boosted as well. And I got my booster yesterday, so I'm super excited. So thank you for all you're doing, and stay safe, Wakefield.
Thank you. Thank you, Julie. Thank you for all the support from you and from the town council. I know it means a lot to everybody here. Anthony, why don't we turn it over to you?
Great. Thank you, Steve. And also thank you, Julie, for those words. I think it's more important now than ever to really talk about, what measures we can do. And the booster, as you mentioned, the FDA approved boosters for everybody 18 and over. This is an important step, I think, for us to consider. We're fully vaccinated. The more we can get this out there, the better. We'll be working on possibly bringing the booster here to Wakefield to make it more accessible. There are other places that are already doing that with the pharmacies and, with the doctor's offices, but we'll be looking to see if we can make any plans for that as well. In terms of numbers, I think Steve hit it on the head there in the beginning. We've been seeing a little bit of an increase here in Wakefield, but this has not been isolated to us. This has been seen in the region as well. I believe currently we are at 6 cases average per day. We've been seeing a slight higher increase in the schools, and so Doug will dive into that a little bit later in terms of the numbers. But in terms of gatherings, we are headed into the Thanksgiving season here. We are recommending everybody, please be safe, please get tested. If you're not fully vaccinated, you are putting yourself and others at risk. So please consider doing the right thing and try and get tested before seeing others. Currently, we are at 108 active confirmed cases. And so we're still doing contact tracing for those individuals that are testing positive. And for those we've identified as close contacts, we are trying to give the right advice for. And so if you have any questions about isolation or quarantine protocols, we are always available. Please reach out to either our contact tracers who reach out to you, or if you have any questions, please reach out to the health department. We'll be able to answer those as well. The exciting news is the rollout of the 5 to 11 COVID vaccine. And so over time, this has, in other municipalities and other places, they've been able to roll this out. Our first official 5 to 11 clinic is this Saturday. It is 9 to 4 at the Galvin Middle School. We are very excited to see everyone there. We've had a lot of signups so far. I just want to stress the importance of getting your vaccine, but also if you're not able to pre-register, please come in, please walk in. We'll be able to register you on the spot. They are first come, first serve, but we have enough numbers for everybody. So please come in and we'll be able to help you out. If we're looking at the numbers right now in terms of vaccinations, the age group 65 and older has been slightly improving each week, and we're actually at 90% now. And so we're about to surpass 90% in terms of 65 and older who are fully vaccinated, which is great news. I think for those who are at higher risk of serious complications with COVID, this is showing that it is working. We're reaching the groups that need it. As we can see, the numbers in the other age groups as well, 30 to 64, those have also increased. They are now over 80%. And so we are headed in the right direction in terms of getting everybody their shots. We still have a little bit more work to do in the school age population as well, 12 to 15, and then as well as 16 to 19. We can definitely do better in those categories, but the sooner we can get more people, vaccinated, the sooner we talk about how we can get out of this pandemic. as reflected with the higher numbers, we've been seeing, positivity rates in Wakefield and in nearby communities increase. So we're about 4% positivity right now. And so this is just a reflection of, some of the, maybe someone, everyone's getting a little bit more comfortable and, maybe a little bit more lax, wearing masks and close indoor spaces. And so we really want to make sure that everybody, maintains their guard and knows that we're not quite out of it yet. But there is a light at the end of the tunnel, the 5 to 11 vaccine and the boosters availability. And I think the important piece of all this Wakefield data is that we can put it in the context of our surrounding community as well. We do not operate in a vacuum. We have lots of travel, to nearby towns, visitation of businesses. And so we do want to look at, Middlesex County as a whole. And right now, Middlesex County is in the high transmission category, high community transmission category. And so this is, really speaking to, the need for us to continue to test, continue to be vigilant about quarantine and isolation, and make sure that we're keeping track of the numbers. Because right now, we are at, the case rate is 168 cases per 100,000. And so we're looking at, pretty high numbers across the board. And, luckily, as a county, we are at about 81% in terms of fully vaccinated individuals over the age of 12. And so clearly this is working. And once we have, more clinics and more availability of the 5 to 11 vaccine, I think we'll be in better shape.
Thank you. Thank you, Anthony. Before I go forward, when you think about a lot of people that were vaccinated, February, March, they're coming up on, 7, 8, 9, 10 months out. I think that really highlights the importance of the booster. And the state made the change, the change for everybody. And I've got to say that, it's not all that hard to set up a booster shot. Go right online, CVS, Walgreens. It's been run out, differently. So please do that. I think that really is making a difference in my non-medical technical opinion. So just thought I'd throw that in there. Tom, can you add anything, if you don't mind? And then I'll run through the rest.
No, excuse me. I think everyone touched on it. It's just that still have to be vigilant when we're going through the holidays. We always see an uptick when we do have the holidays. Everybody's going to try to get together, but mask when you just are uncertain. I think that's probably the best thing. And make sure you get the vaccines. I mean, it's great. We have the rollout now for the 5 to 11, and I think as long as Anthony is getting the vaccine in, we probably continue doing those clinics going forward. So there's a lot of good things for the town. Just have to make sure that people are taking care of themselves.
Great.
Fine.
Thank you. Thank you, Tom. Doug.
Thank you, Steve. I appreciate it. Anthony, thank you for your updates. I like the beard, by the way, very distinguished. You look older. No, well, not really, but yeah. So quick question, Anthony, just again, the 12 to 15-year-old age group, where are we at there?
So we're about 25% of the 5 to 11 age group that have their first shots, and which is a great statistic here in Wakefield. We're pretty far ahead in a lot of compared to other communities. And so I believe this weekend we're gonna, if we're able to reach numbers that are already pre-registered, we're gonna be close to almost 50% that are gonna reach at least their first dose. So we're making really good progress there.
Thank you so much for the help and support.
And the 12 to 15, Anthony? I think, could you give us the update on that too? Do you mind?
Sure. So the 12 to 15, we're at 74% right now. They're fully vaccinated. We're doing good in that category as well. We're almost at the 80% mark. And so that's an important mark for the schools, because we've been seeing, at the middle school level where, the cutoff for the vaccine has been 11 to 12. And so once we bridge that gap, I think we'll be in better shape in the schools.
Thank you so much. So number of positive cases that we've had in the schools this week, 17 total cases with 14 students and 3 faculty members. Numbers in quarantine, we have 80 students in quarantine and 2 faculty members, so 82 total in quarantine. We've consistently been giving about 100 or 80 to 100 test and stay tests a week, which I think is very positive, because that allows us, again, to keep students in school learning with their peers, which is always a first choice. In regard to the distribution, in quarantine, only 20 of the 82 are directed by the Board of Health. And 56 are quarantining because they are symptomatic, which again is kind of a telltale for us, or a data point that leads us to believe that, parents are making decisions to keep their children home when they're symptomatic, which we greatly appreciate. And as we go into the holiday, we want to wish everyone the best to you and your families during the Thanksgiving break. And we will see you when you get back. If you have any questions for us on the school side, we would urge you to be in touch. Thank you very much.
Thank you, Doug. Laurel, I'm going to switch over to our Board of Health members. Thank you, both you and Elaine, being here today. Love it. Laurel, do you have any words of wisdom for us?
A couple. As a segue from what Superintendent Lyons just said, we're going into winter. We have more than COVID going on. So flu vaccine remains important, because we're, symptomatic could be anything. It could be a number of viruses. And it's kind of funny because, or ironically, wearing masks actually reduced kind of all comers for viral incidences last season. So it kind of works. I don't want to be masking forever, but definitely continue the hand washing and and all of the personal protection hygiene work that we've been doing all along. It's always good to be reminded that Middlesex County is in a higher place, so that does in fact bump your decision tree in regards to masking in a store. We have mandatory masking in our municipal buildings, including the library. And most people I notice have been masking as they go indoors to a store, but it's variable. And I believe the uptick in grocery stores will be even denser this coming holiday season. So just be mindful, keep up the good work. I have been challenged with someone wanting a Friendsgiving with people who have been throughout the land, and my decree is fire pit or nothing, or every window in the house will be open after Thanksgiving. We are getting my mom, who's been in a nursing home for over a year, out for the first time, and we don't want to blow it. So,
Right.
Let's just make sure the kids are, and the folks who are really moving around in the world, just be vigilant. And we're looking forward to tomorrow. We're doing everything to make it a pediatric friendly event. We're using the middle school. Folks are coming in through the usual office door and will be directed to a waiting area. We're using the library learning commons as our injection site. We have a fabulous team. Again, it's like the band is getting back together. We anticipate that will run as beautifully as it ran last winter with, and I actually think we're going to have mixed results. I think so many kids are excited to get this over with that I'm optimistic about how it will go. So, and again, just so people are aware, it is a different formulation for the 11 and younger kids. So we will not, we're keeping it just at 11 and under. We'll see what happens in the future, but this is the only vaccine we have at hand. And just to remind people, these vaccines are a little trickier than others that we've used in the past. They take intense concentration. Elaine is our vaccine mixing guru, and we'll continue to do that tomorrow. I'm going to be in the middle of the room kind of conducting traffic. So we look forward to getting to this cohort and improving as things go forward. Have a safe holiday, everybody.
Thank you. And I think that's a great point, Laurel, that this is not a booster clinic. Not the vaccine is different. It's not that we're going to mix it differently. The whole thing is that we're getting is different.
It's a different dose. Yeah.
Right. So that you can't come in and be like my mother and ask a question until you get yes. No, that's not going to work. This is totally different. We can't do it. So speaking of my mother's, Elaine, would you like to add anything? You have to unmute. There you go.
Sorry about that. I have like 3 different devices running. Just want to speak on behalf of the tracers who have done a fantastic job, and to remind people that when you do get that call, I know you get a lot of crazy calls and you don't know who it is, but if you get a message from us, please try to call us back as soon as possible. Our tracers are working morning, noon, and night, and I'm hoping that Anthony will give us Thanksgiving Day off. I was going to ask that later, but I really think we should curtail a little bit. And to remind people, as Laurel said, flu is out. We do have flu cases. It may be a little bit high this year, they're claiming, but a lot of people, if you do go to get tested for COVID, some places are asking you if you also want to get tested for flu. And we do advise you to do that. Do the 2 at once and let's see what's really going around. And to thank everyone for volunteering. I can't wait to see everybody this Saturday and then again on Saturday, December 11th. Maybe Santa will come for us on that day. Thank you.
Yeah, I'll be there in the afternoon. I have an appointment in the morning. I'll be there probably around 11 or 12. And hopefully I won't be bouncing people like I had to at the beginning. This will be a much more congenial bunch. But I do have a question. We have, was mentioned we have 108 active cases in Wakefield. And we have what, about an 81% vaccination rate as a community. So the 108 cases that we have, is there a sense from talking with the contact tracers, are they, you have the flu when you're on the couch for a couple of days, or are you hospitalized? So I think maybe if either Laurel or Elaine or Anthony can jump in and kind of talk about that a little bit.
I think you're seeing a lot more of breakthrough cases. We have the high cases, and you're seeing a lot of family members. You may have one parent may be fully vaccinated, the other one may not. And then you're seeing the cases, and then you're also seeing it come into, especially siblings in the same schools. So the siblings in one class that you might see a little bit of an uptake, and then they're walking home and they're spending time and a little bit asymptomatic. So I think you're just seeing that little bit of increase because we're indoors more and more people are doing things. There's more birthday parties. There was Salem. There was a lot of different places, and we do tend to let our guard down a little bit. So, and I think, I don't know, that's what we have been seeing the past couple of weeks is a lot more involved with families.
Yeah, it is. We do need to keep vigilant, like everybody said. Does anybody have anything else to add? Anything, Anthony or anybody? We're all good. Okay, well, again, everyone stay safe. It's going to be a nice day on Thanksgiving, long range. It's going to be 50+ degrees. Let's be hardy New Englanders and try not to cramp in too much. I mean, you can certainly have the windows open. You can spend some time outside. I know that's what I hope to do in our family. And just be smart and be safe. And for those of you that haven't got your booster shot, I'm telling you, it's very easy. Go right online, CVS, Walgreens, 5 minutes, you're there. It's you're doing it for yourself. You're also doing it for everybody else, for your older members of your family, your younger members that can't get vaccinated yet. There's kids that are under 5. So let's keep everybody safe. And everyone have a wonderful Thanksgiving. And Anthony, I hope you do give them the day off. That's my vote. Give them the day off so they can recharge. Okay? Great. Have a great weekend, everybody, and have a wonderful Thanksgiving. Bye.
You too. Thank you.